We are so excited to have my friend, my fellow yogi, and best of all, the most wonderful pediatrician in the Chicagoland area, in my opinion, Dr. Lamia Katbi, with us. And I wanted to bring Lamia on, especially now because I know I have a grandson. I have many questions for you, but Lamia obviously works with children, she's a pediatrician, and their families. And so I'm sure that COVID has affected the dynamics of the family, what you're seeing in kids as far as their mental health, mental wellness. So I wanted to start off just by kind of throwing that out there and get your response. What are you seeing?
Okay. So, everyone talks about the pandemic. So we don't want to talk about quarantine or pandemic. Pandemic is here, and we may end up with an endemic instead of pandemic because it might be here to stay. And that's what we're seeing. So it's very important now to say, what can we do now? Okay. This did affect all of us, children, teenagers, adult, elderly, everyone, right? Okay. So now what can we do? Okay. So here's what I would tell you, what I am seeing and what I am telling my patients right now. Okay. I am telling my patients the following. Again, you know what we did yesterday, let's get rid of it. Let's forget it. We start today. We've all watched Netflix. We've all binged on stuff. We've all gained weight. We all did it, right? Let's start today. Okay. What can we do today? Okay. So here's what I am telling them, what I'm suggesting. I tell my patients, I can give you the recommendations. What you do with it, it is really up to you, right? So get out. Take the children to the park. I am telling them, join the swim club again. I am telling them, join the activity again, the soccer practice, take them to baseball games. I am telling them, please do in school, like in-person school. Do not, unless there are always exceptions, okay? I am telling them small gatherings. I am telling them like birthday parties in, within reason. That's what I am telling them. Okay. Fear is major. I understand it. I really know what that is. But at the same time, I'm just like, what can we do about it? Okay. If you don't have courage to change, you cannot, you're going to stay living in fear. Okay. And here's what I'm telling parents, and that's like very important, really dear to me. What I'm telling parents, guys, I am telling them, you know what? Face your own fears, address your own fears. Don't address your anxiety. It's going to reflect on your children. It's going to affect your children. So I want parents not just to take their kids out. I want them to face their own insecurities, fears, anxieties, and there are lots of ways to do that.
Yeah. So, because a lot of that, the kids sense that, right? I mean, they sense the fear, they sense the anxiety. That's why it's so important to have a healthy household, that both parents are on the same page and make sure that they're not feeling any stress from them. My question is obviously these poor kiddos being taken in out of school, and their world has just been unearthed. And I know when I was raising my kids, we're always told the key thing kids need is stability, for their mental health and physical health. What are you seeing on the downside on all the anxiety that these kiddos are experiencing?
Yes. So obviously, the households have been, like lots of them have been disrupted. Routine has been disrupted. Kids love routine. Kids love like going to see their friends. We're social beings. Kids are social beings.
Yeah.
Gravity, other. So what we're seeing, and when this is happening to the children, if the household is not healthy and parents did not actively seek socialization for these children with cousins, with friends, a small group of friends, these kids are getting really anxious, fearful, insomnia, like sleep disorders we've been seeing. I can give you an example. For example, one of my children who's very vocal, he's only 5 years old. Okay. Around Thanksgiving, after Thanksgiving, his parents brought him to me because he was causing himself to throw up every day before school, because he sensed and heard his parents say at some point that, you know what, if I throw up, my parents will not send me to school because I'm sick now. And then his parents didn't know why. During my conversation with this 5-year-old who's extremely bright, he said, if I throw up, don't go to school, don't catch COVID, don't die.
Oh,
man.
That was one of my breaking points. Everyone has a breaking point. That was one of my breaking points, that last year. And then another child, a 4-year-old, when I asked her, what Santa's going to bring you around Christmas? And she looked at her mom with complete, surprise. And she goes, Santa's not coming. And both mom and I was like, why is Santa not coming? And she goes, remember the germs? And I mean, that broke my heart.
Yeah.
This is just like 2 examples that's I knew about how this pandemic affected my 25-year-old daughter has been affected. She's a young adult, but her anxiety level was just unbelievable, despite me reassuring her again and again, within reason, obviously, not reassuring her that say, hey, go and do whatever. No, reassuring her within reason. But it was hard.
Yeah, because eventually it does affect them physically, the mental stress, and which you have to deal with on both ends, both the physical and mental. And boy, what times we live in to have kids purposely make themselves sick.
I'm comment on that because kids' anxiety manifest in 2 major body parts. Let me just say, or systems. I must say, it manifests with headaches, or and most commonly actually abdominal pain. Okay, so many times, especially at the beginning of the school year, we see many kids, and ER will confirm that, with abdominal pain because of anxiety and fear. They don't know how to say I'm fearful of this. I mean, most adults cannot say that anyway. So they manage with and adults migraine headaches, or that's the third. Chest pain, third one. Excuse me.
Right. I mean, are you seeing any ulcers in kiddos? I mean, do they develop in that young of age?
I cannot. I mean, lots of abdominal pain. Yes. We don't diagnose ulcer. I mean, I have to send them to GI. I suspected, treated as such, but that needs a GI specialist, for further testing.
Right.
But patient of it. Yes.
Oh man, so sad.
So I wanted to just kind of go back into the routine part, because I love what you said about that, how important it is for the families to have the routine. What are you seeing? Are you talking specifically to the parents about, I know in the beginning you had mentioned all of this, but at some point, are you just saying, look, being holed up isn't doing any of your family members any good? Because I would, guess that there's tons of stress in the family unit because of COVID.
Correct.
So, kind of breaking out of the stress mold and into a healthier routine.
Correct. So, yes. And, and I try to be mindful of my patients, and it's if somebody lost their job, or they're working from home, or their socioeconomic situation, it's because which it's different, and you have to really, really address it in different way. And I try to be mindful of it. Okay, so I take that into account when I address any of these things, because I cannot just tell everyone go and do this. I mean, again, I make patients. Okay, so that's why I may say just like, what, take it in small doses. If you're feeling anxious, take it with, just take the first step. Okay. And they're all coming for advice because they look at me and it's like, are you sure? And I say, yes, there are more people who are vaccinated right now than the total number of COVID-19 infection in the United States, which is a good, promising thing. Okay. And the more adults we vaccinate, the more, the more security, courage, like we're going to feel, hopefully. So that's what I'm trying to count on, the parents, when like good feelings, that they want to do good,
Right.
And want to do good by their children. Most parents want to do good by their children. That's why they have them, hopefully, and they want what's best for them. So they really do. Listen, I mean, I believe I am making an impact on my patient population. And I know that because I told people recently, it's like, I don't like paperwork. I love computer. I love talking to people, interacting with them, listening to the children, observation is one of my a strong, probably way of managing families. And what I noticed that this year I'm so excited about filling paperwork, meaning school physicals, sports physicals, Pop Warners, and I go, bring it on.
Oh man, you're bringing back some memories.
Something in the past I used to dread because there's so many,
Yeah.
and now I just say I am so excited because parents are willing to do the work, willing to work on taking their children back, and children are resilient. Let's not just forget this.
Good point.
Children will survive it. Children will get over it. Children learned how to wear the mask way better than adults did.
They did.
And kept it and
They
it
do.
on. Children are resilient. They will get through it. That's what I want them to know.
Yeah. So, doctor, one question I have: am I drawing the wrong data here? Aren't children, specifically the primary age kids, aren't they more resilient to this virus, or is that not true?
That is very true. Actually, it's fascinating, which is actually amazing, because if this virus was affecting children, the fear would have been greater. Children, this virus does not adhere to the pediatric, children's cells as much as it adheres to the adult one, which was a major from the beginning. We knew that. Okay, and that's why I'm like, yes, we need to be mindful. Yes, we need to practice good hygiene, but no, it does not. And transmission from child to child is not as prevalent or as from adult to adult. Most children do not give it to adults. It's vice versa.
Right. And so now we're looking at an environment where just recently in Indiana, the Indiana teachers are now being included in the vaccination. So, I mean, we're dealing with a physically safe environment for the teachers and the kiddos. And CDC reduced the requirement for the distance. I think it's down to 3 feet. So that's even better for socialization and kiddos getting together.
I wanted to just touch on that too, the socialization part. So I have a 10-month-old grandson who has not experienced the mommy and me groups, the socialization with other kids his age. Are you seeing, developmental wise, are you seeing any differences in kids?
My families who really chose to, which is okay. Again, everyone's sense of security and safety is different, correct? So for the families who chose not to see anyone and truly isolated themselves, which I have quite a few of them, I do have more social anxiety, separation anxiety, stranger anxiety, which is common in children.
Yeah.
Stranger common in children starting at the age 8-9 months, and it stays for a while. But definitely when you're not interacting with other social beings such as other children or human being, I am seeing more of it for sure.
So get them out there, socialize them so that they feel connected again, connected with their peers, connected with their teacher. Yeah, and it's, gosh. Yeah, I just remember when I was sick one time in school, what kid doesn't want to get away out of school? But man, after like the second day I was home, it was like, get me out of here.
Right?
There's only so much romper room a person can watch.
Right? And I, you know what? And I have to, like, there very few.
Romper room?
Yeah.
Oh gosh.
We're dating. Hold on. We're dating ourselves. All right. Hush.
Okay. Sorry.
I am when I was recommending and advising for in-person school, when the entire everyone was divided, and I respected everyone's opinion, everyone's boundaries, everyone's fears. But my recommendation was for in-person, for again social aspect, emotional, academics, physical activity also. It's very important. And so when there were few kids that when I listened to them, I said, you know what? It's better for you to stay home. It's not. So we really cannot. There is no size fits all. Okay. Yeah. So just we have to individualize everything we do, in especially in medicine, I would say. The way I chose to approach it, as opposed to lots of other people approaching it, I had a choice, right? And every one of us had that choice. I made that choice, conscious choice, of not listening to the news. I don't listen to the news. So it's one of my biggest advice, actually, for even parents, by the way. Please do not turn the news, 24/7 or even 1 minute a day in front of your children, because your children will absorb that. Their subconscious will absorb that. It's going to affect them. So I would say, don't listen to the news. So I made that conscious choice to not listen to the news. And what I did, of course, I kept educated through my institution, through, CDC, through the Indiana Health, Department. So I was very conscious about it. Then I said, I can either just stay home and, do nothing. Or I can dive into this. And I chose to dive into it, meaning I chose to go to work every day. So I was involved. I volunteered to go every day for 6 weeks at that quarantine time and see patients. I was not directly involved with COVID-19 patients in the hospital, but I was involved with seeing the newborns and pediatric patients, and that was challenging because to talk to new parents during giving birth during a quarantine, that was quite challenging, actually. So I did that, but then also because we were not as busy because of quarantine, and I chose to stay active. So I stayed extremely active. I took on walking, hiking. I took on biking. I became an avid biker, besides being an avid yogi. And I felt that, kept me sane. That kept me really in good space. And it's my breaking point again was, everyone has a breaking point. My breaking point was when that child told me that, and the two children said that, and then I couldn't host Thanksgiving because my son had COVID-19, because he's a freshman in college, and of course they don't follow, proper hygiene. And so I was in my house with his girlfriend for a week, and I couldn't host Thanksgiving. And my daughter, because of her anxiety, did not come from Los Angeles. So that was very difficult for me. And then during yoga, I hurt my back. So I was like,
Oh,
what? You know? So I acknowledged it, worked with it. I did my therapy, and you know what? I am here. So I
Yeah.
would count on their if it role like get a role model, like have a role model in your life,
love
reach for
that.
people in your life, get a coach if you can, or you if you need to, read, like get self-help books, like to help you navigate through like difficult times, because we all go through it. The only difference now, we are all going through it together, not one person at a time. Okay. So that's why I always like to share this, because I feel like, and I'm not saying it to brag, I'm saying it because that was my choice.
Right. And it's important to be a mentor to these kiddos because it's the same thing with adults. You've got to remain active to remain healthy. And the same
Right.
thing is for kids. I mean, they've got to get up, they've got to walk, they got to run. I
Yeah.
mean, that is something that's been absent, the phys ed and all that. And it's like, oh boy. And
Yes.
have
But
you
they've
seen,
come back. They've come back.
yeah,
I'm
have you
telling
Oh,
you.
it's
seen
here.
an increase in child obesity during this time?
Oh, yes. Oh, my gosh. And oh,
Yeah.
but at the same time, so I'm big on like healthy living. I practice healthy living, and just like, and I preach what I practice, not vice versa. So it's like, uh, so for me, it was really challenging for me to, how do I address this? How do I address this? Mindful. And I just chose not to. Well, I would tell them, and that was early on. And like, I had to choose that. Like, I mean, timing is everything. So if it was during, or like maybe shortly after the pandemic, I was like, you know what? It's Christmas in May, July, that's it, and we'll address it later. Now what I tell them, you know what? We did it. It's done. It's over. What can we do today? So
Love that.
Yeah. Yeah. Keep things behind that need to be left behind and stay
Mhm,
present.
mhm,
Yeah.
correct,
I
correct.
love,
Are you into mindfulness, Bill?
I
Are you?
try to be.
Uh-huh. No,
It's the
that's
people that aren't that steer me back. No, I shouldn't do that. I'm
breathing.
blaming. Yeah, breathe,
Breathe.
breathe, and remain
On
in the
my,
moment.
yep.
Yeah. Now, when I am, ever since I moved closer to the lake, it's been a lot easier. I'll tell you
uh-huh.
that.
Oh,
In fact, I'm kind of stressed out because I'm away from the lake right now, and I'm like, oh. She saw a lot of it when she came in. It's like, all right, I want to get back to the
Yeah.
lake. There's something about the water with me, and the water is just, yeah, it's relaxing.
I have a pool in my backyard. People tell me like, how often do you get in it? I say like once a year. It's not. It's just for me to look at. It's not for me to get into. Just like inside. I just love looking at the water. I
Yeah.
love it. Yeah,
I
it's
love when
relaxing.
you post pictures.
Oh,
Oh, I love my backyard. Yes.
And it's a beautiful backyard.
yeah, I bet.
So, my friend, wonderful
Mhm.
Dr. Katby, thank you so much for
Yes.
sharing your knowledge and just having this conversation with us. I appreciate you so much.
I do.
Mwah.
And if someone was interested, maybe listen to you and say, "Wow, she's pretty neat. We'd like to maybe have her be our pediatrician." How do they get in contact with you?
Oh, I mean, they just Google my name, probably. Like, I mean, I
Well,
they
yeah, we can
uh,
also look up your contact
Yeah,
information
I
and put
have your
up there. Yeah,
contact
yeah, we'll get it
info.
up there on the
like
video.
if no, I feel like I work for community healthcare system, so I am on their
Ah,
web. Well,
okay. All
so
right. So,
I'm like they can look me there, and yes, I mean that most people, when they find me, like they just, because people love Google reviews, so they Google me, they come to see me. Yes. So no, thank you so much. It was fun. I enjoy it. Melinda knows probably, and the reason I want to mention that, you may not want to put it out there because it's not official yet, but I am in process of writing a book about healthy living.
hmm,
And you said, because it was, and I don't share it with many people, like, so it was the 4 pillars of health, and now it's the 5 pillars of health.
Mm.
And one of them, the first one, which is very dear to me, like sleep, eating healthy mindfully. I call it eating mindfully, physical activity, mental health, and I added the breath.
Yes.
So breathing. So it's like a mind, like kind of, as my daughter said, it's like a modern twist to the healthy living. So when you said, and that's told you to breathe, and I'm just like, yes, I'm so excited because I really need more people to know how to use their.
You know what's
Exactly.
interesting? What I found when I'm most stressed, I unconsciously hold my breath.
That's what everybody does.
Yeah, I didn't I just caught myself doing that the other day. I was like, ooh, gosh, working out, sometimes I'll catch myself doing it.
You gotta breathe, babe.
Yeah,
Gotta breathe.
yeah. Well, we should probably start wrapping things up here. This has been great.
Thank
Absolutely
you.
Phenomenal. Thank you. Thank you very much for all your wisdom and all the pointers you've given to parents out there. This has been great.
And how much you love your kids and your families.
Oh, I really do.
I know
really
you do.
It's like I'm blessed. I'm very blessed. You know what? It's the biggest blessing. Yes, thank you.
With that, let's start wrapping up.
Yeah. Thank you.
Thank
you
you
are very
very
welcome.
much. You have a very safe and enjoyable evening, and we'll say goodbye for now.
Okay.
Bye,
perfect.
everybody.
Bye.
Bye.
Up Next with Bill and Mel is brought to you by Dutch Farms, Graham Financial and Wealth Management, Lerner and Rowe Injury Attorneys, Sip Coffee, Tiger Plumbing, and Executive Suite Squared in beautiful Hammond, Indiana, home of